Sarcopenia is a condition characterized by loss of skeletal muscle mass and function. Primarily, it affects people in the middle age bracket and becomes severe as the years advance. To be sure, we have all seen people who have been weakened by this disease. It is said that, after 30 years of age, the body loses its strength, and tends to become soft and flabby. A person can expect gradual muscle tissue loss as sarcopenia begins to slowly set in. The term, sarcopenia, which derives from the Latin roots, sarco, for muscle and penia, for wasting, is the natural and progressive decline of muscle. Fat storage also plays a role in sarcopenia and thus, osteoporosis as well. If a muscle tissue contains fat, it will be less strong than lean muscle tissue. Visceral fat, the abdominal, spare tire, that increases the risk of diabetes, heart disease and other chronic diseases are linked to sarcopenia. There seems to be a connection in sarcopenia as the root cause of all degenerative diseases. I was listening to a talk on sarcopenia by Fred Bartlett, Reversing Sarcopenia and Living a Full Active Long Life, Grand Rounds in Urology, YouTube March 6, 2018, a 86-year-old who, to his me, seemed to be in his 60s. He is not a doctor, nor a medical person but a lawyer. He seems to still ski and do all physical activities with ease. He is a proponent of physical activity. Until very recent, the term sarcopenia was not known, and even now, I dare say, many people don't know it, probably. Even some doctors might not know it. However, everybody knows what happens to people when they grow old and susceptible to ill health. They grow weak and feeble and can only do things with difficulty or not able to do at all. It is usually diagnosed as arthritis, joint, knee, hip or back pain and a host of diseases such as osteoporosis, osteoarthritis and other names. What causes sarcopenia? Sarcopenia, from what is known by medicine, affects people in their 40 and 50 or perhaps earlier who live a sedentary life, who work at a desk, have poor nourishment, bad habits such as excessive alcohol and cigarette smoking. Sarcopenia causes muscles to waste and increases the chances of falls, injuries and complications. By the same token, people who work in manual jobs in the open fields and who do back-breaking work have a considerable less chance of being victims of sarcopenia. How to address prevention and cure? Regular high-resistance exercise helps. The patient needs to lift weights, do push-ups, sit-ups and such exercises. These ought to be done at high-intensity level to be effective. Walking, bike riding helps but does not specifically address the sarcopenia issues. To combat the effects of sarcopenia, middle-aged adults will benefit the most from a workout that emphasizes strength building and weight lifting routine. This is also the method to prevent sarcopenia which, in the long run, is better than cure.